Well, welcome back. Thursdays on Fox Wilmington, the day we usually talk about your health. Well, not your health, but your health. November, also National Alzheimer's Awareness Month. Dr. Charles Herring paying us a visit. Dr. Herring specializing in internal medicine with Hanover Medical Group. So we'll talk Alzheimer's. Let's get right to it.
Sure.
The cause of this illness, what is it? Are there indicators of family history and something like this?
Well, sure. It's the eighth leading cause of, about 1 in 8 Americans, 1 in 8 Americans will have Alzheimer's, older Americans. It's the 6th leading cause of death in the United States, and there's about 5 million Americans right now with it. We believe it's related to the accumulation of a protein called beta amyloid in the central nervous system. Now, why this happens is not clear. They worked out some of the genetics, but genetic cause is really only about 1%. You know, some people say, oh yeah, I have Alzheimer's in my family, but if somebody lives long enough, their risk goes up and it may not be genetic. So research is being done. There are some drugs in clinical trials that affect beta amyloid production. They really haven't panned out just yet. There are some drugs available for it. Americans, when they develop this disease, usually it's very subtle. They develop problems with recent memory. Often somebody will be embarrassed and may not, come to medical attention. They'll try to make up for their forgetfulness, and then eventually, usually it's a caregiver brings somebody in and says, you know, mom or dad's not acting like they should. It can affect behavior. It's kind of very insidious, and then they have loss of physical capacity that can go along with that later.
Is there a population that is susceptible to this beta amyloid?
Well, like I said, genetically it's about 1% hereditary, but the rest we're not sure why people develop it. Right now the drugs we have are 2 classes. One's called cholinesterase inhibitors, and they raise a chemical called acetylcholine in the brain, and that's the brain food, so to speak, and that can help. And there's another drug called Namenda that can help. But really we want to raise awareness. People, if they're concerned about their memory, they need to come in and get checked. There are a lot of things that can masquerade like Alzheimer's. You know, people use the word Alzheimer's for all dementias, but there's lots of other causes. Some people have dementia related to multiple strokes. Some have dementia related to physical problems, water on the brain. Some have metabolic problems, underactive thyroid, vitamin B12 deficiency. So you really need to get checked because you want to exclude those things and treat them if they have them.
I'll give you about 20 seconds to do it. Very briefly touch on treatment of what patients can expect.
Well, unfortunately, it's kind of a slippery slope. There are 2 drug classes that we can use, and it's not like you administer the drug and all of a sudden somebody's back to normal. If a person starts here, and let's say 2 years from now their functional status and memory will be down to here, in clinical studies, the group treated may decline less, but they still may decline, although some people do have significant improvements. But the earlier you treat people, the better they do over time. So you want to diagnose this early. Okay,
and as always, I always end these things with, if you have any questions, you always want to consult your local physician. This was very brief, and your physician can give you obviously more treatment options with your problems there. Doctor, I appreciate the time.
Thanks.
Thanks for stopping by.